Good morning. Thank you for joining me today. See, I'm stacked up with water this morning. We know that these have been a tough few months for all of us here in Manitoba and across the country and in many countries around the world. Many families have, in our province, have been juggling schooling for their children while trying to work from home. It's not easy. Others have been facing financial hardships, whether it's job loss or having to shutter a family business, and that is very, very sad for all of us. And of course, there's the emotional toll, whether it's concerns about your family's health, your job security, or both. Our number one priority during this unprecedented global pandemic has been keeping you and your loved ones safe and ensuring a healthy Manitoba today, but also in the future. Notre priorité numéro une au cours de cette pandémie mondiale sans précédent a été de vous protéger, vous et vos proches, et d'assurer la santé de Manitoba aujourd'hui et pour l'avenir aussi. And that's why your Manitoba government added critical mental health supports during these challenging times. Since we announced the Ability CBT virtual therapy program, which is a program to assist Manitobans who are experiencing mental health challenges as a consequence of COVID-19 or in supplement to other challenges they already are facing, I am pleased to tell you that we've been able to offer help at home, counseling and therapy to more than 2,100 Manitobans who have accessed these services. And I would emphasize to all Manitobans that if you need help and you need support, help is still available to you. You can access these services at manitoba.ca/COVID-19. I want to take this opportunity today to say thank you to Team Manitoba. Your hard work, your dedication, along with early and decisive actions, have made a huge difference in our fight against COVID-19. And the Manitoba team has demonstrated to all Canadians and to one another, time and time again, its strength, its empathy, its courage, and its resilience. On April the 29th, our government unveiled Restoring Safe Services Together, Manitoba's Pandemic Economic Recovery Roadmap. It is a Manitoba plan. It is made by and for Manitobans, and it's made to allow us to move forward with confidence, to slowly and carefully and on a continuous and sustainable basis get back to business, reopen our communities, restore our way of life. Our plan is evidence-based. It lays out the groundwork to ease public health measures that we have had to take in the interests of protecting all of us against this pandemic. We've been able to create widespread public awareness, and I say thank you. I say thank you to those who have helped spread the word, interest groups, labor leadership, our media. This has been a tremendously important aspect of how we've made the progress we've made to date. Getting the information out to people on how to fight COVID has been very, very important. And Manitobans continue to respond by practicing the fundamentals, by adopting physical distancing behaviors and other behaviors to make sure they stay safe and they protect others around them. The measures that are in place have successfully, to date, flattened the COVID curve, and that was our goal. That's resulted in fewer instances of COVID-19 in this province and fewer rates of positive tests from peaks that we had experienced in early April. And versus other provinces, with very few exceptions, we have certainly done better than you're seeing and hearing about around our country and elsewhere around the world. A critical element of these flattening efforts and contributing to Manitoba's continued success is our high levels of testing, tracking, and the willingness of Manitobans to adhere to the isolation necessary to protect themselves and others. As a result of these collective efforts, in phase one, we were able to ease some restrictions, including in reintroducing the opportunity for elective surgeries, non-urgent health services, such as dentists, physiotherapists, outdoor recreation, playgrounds, golf courses, campgrounds, and a number of retail businesses, clothing, sporting goods stores, restaurant patios, hair salons, while ensuring that physical distancing measures remained in place. Key criteria have been met since the implementation of Phase 1, allowing us to look at further easing public health measures. There's a lot to take into consideration as we restore our services, but mostly we want to do that safely. I was reading a piece in one of our national newspapers on the weekend in the Globe and Mail, and it referenced the need, as we move forward in these next phases of reopening, it talked about the need to strike the right balance between safety and freedom, between health and economics, between inspiration and regulation, endorsing innovations and preparing for a potential reversion, along with compassion and invigoration. I'm proud of the work our government has done. I'm proud of Manitobans for the work you've all done. And I say we've struck that balance very, very well in Manitoba. But we must maintain that careful balance as we move forward carefully to ensure that we continue to lead in resilient recovery. Last week I shared with you a draft second phase plan that would ease some additional restrictions. I said that it would be up to Manitobans, and since that time I'm able to say again that my faith and confidence in Manitobans has been heartened and strengthened as we continue to keep that COVID curve flat. We asked Manitobans if they'd share their thoughts with us, give us some feedback on our draft plan, Restoring Safe Services Together. And since we unveiled that draft plan just under a week ago, we've received more than 5,200 examples of input on our survey feedback forms. And we hosted 3 different public telephone town halls, which had over 50,000 participants from across the length and breadth of our beautiful province. We also provided anyone who wanted the opportunity to share their thoughts through the Engage Manitoba website, and we'll continue to use that site as an important resource for Manitobans to share information, for us to share information with Manitobans, and for Manitobans to share information with the government as well. Especially, of course, we're focused now on helping our small business community by answering questions that they may have on restoring services safely. So I want to say again, thank you to Team Manitoba for stepping up to the plate. As a result of your hard work, and based on advice from our public health experts, I am very pleased today to announce that we're going to be able to move into Phase 2 effective June the 1st. Some of the services that will be gradually restored include expanding capacity at childcare centres, allowing limited access to educational facilities where physical distancing can be maintained for additional tutorial days, such as one-on-one learning opportunities, assessment, and specific programming opportunities for our educators. Reopening community centres, resuming organized team sport and recreational activities, including theatre and dance. Reopening swimming pools, spas, fitness clubs, and gyms. Expanding religious or other organizations' outdoor services. Reopening indoor services at restaurants, and expanding personal services such as manicurists, pedicurists, and estheticians. I would mention that in each of these categories, there have been developed, in partnership with the various organizations, strict protocols that must be followed so that we maintain the discipline necessary to keep ourselves safe. This is what our small businesses want so that they can remain open and so that they can attract their customers back to their operations. This is what we all want, to be sure that we are keeping each other safe when we go out and that we are able to keep employees and coworkers safe when they go in to a place of work. We're also providing detailed guidance for post-secondary educational institutions and vocational colleges, as well as seniors clubs, so that they too can reopen on a limited basis. While we can take pride in the progress we've made and the additional steps we're announcing today, I emphasize we must remain vigilant. We do not want a COVID comeback in this province, and there is no room for complacency. We'll continue to rely on the advice of our healthcare experts. We cannot let our guard down. I implore you to please stick to the fundamentals. Wash your hands regularly. Stay home if you are sick. And if you exhibit symptoms, please go and get tested. And we've broadened the testing to allow you to go even if you don't exhibit symptoms. We're encouraging everyone to remember that this is a marathon. This is not a sprint. But I'm confident we'll continue to be successful on this track we're on this course we're on, and we keep working together as a team. Nous continuerons à réussir si nous continuons à travailler ensemble, en équipe. Not every Canadian has the opportunity to save a life, but you do, and you have, and we will save even more as we keep working together. Together we will beat this thing. Thank you. I look forward to taking your questions.
Thank you, Mr. Premier. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this morning from City News, Stephanie.
Mr. Premier, Stephanie Lasuk with City News. I noticed what's new in this plan is post-secondary institutions being allowed to allow hands-on learning. Just wondering why this addition was made.
Well, Stephanie, I think there's the opportunity with the doctor's advice here to adhere to the guidelines, re-distancing and so on, and with the cleaning and so on that's necessary to disinfect. Lab equipment, for example, would be one. The universities will be able to offer some limited summer instruction. That's a good opportunity for them, and I know the universities and community colleges are excited about that.
And just a quick follow-up, the feedback that you got back from people on the draft, what was kind of the biggest concern overall that you saw to Manitobans?
I think there was really interesting, kind of an even split. I think a lot of folks felt that we had to, that we're on the right track, and I think that it was nice of them to share that perspective. But I think there's naturally a concern that we be very, very careful. And I think that to describe, there were literally hundreds, if not thousands, of examples of input, but I would say that there was consistent among Manitobans that they want us to be very careful and guarded. We've made a lot of progress, but I think it's clear we don't want to risk the progress we've made by going too rapidly into creating more risk and then having to go backward. And so I would say, in answer to your question, I would say a lot of the individual advice that we received was along those lines.
From the Winnipeg Free Press, Carol.
Good morning, Premier. It's Carol Sanders of the Free Press. Has the pandemic created an opportunity for government to direct universities to refocus curricula and be more job-oriented?
Well, I think, Carol, there's an opportunity that we've addressed in our throne speech last year that many other provinces have already done. In fact, I'm told in close to 40 states in the United States, they have mechanisms so that governments work in partnership with post-secondary institutions in a better way than has been the case in the past, where there's been kind of a separation which stopped universities and community colleges and governments from really seeking mutual advantage. In our discussions with post-secondary leadership here, we're hearing the same things that other premiers have heard and other governors have heard around North America, that there's a real opportunity here for better partnering, to develop programming that is not necessarily more job-focused, but is relevant to the needs of the economy within Manitoba.
Okay. Are there any degree programs being offered right now that you'd like to see cut or changed in favor of something else? And what would that be? What would you like to see more of?
Well, I think what the goal has been in other jurisdictions with the literature that I and others have briefed me on is the goal is to make sure that we're partnering effectively and sharing information effectively in a manner that addresses and isn't isolated from the needs of our economy. So economic advantages can be achieved by pursuing training when it's needed. For example, we need more nurses right now, and we don't need as many more teachers. yet our institutions are slowly moving in a manner that means that we have to adjust. This is an opportunity for us to learn how to adjust more readily to the needs that exist and that are real, to help our young people find work in our province and not have to go somewhere else to find a job after they're trained at one of our universities or community colleges. That rational linkage is best achieved in most other jurisdictions around North America through better partnerships than we've seen in the past here in Manitoba. So we're trying to strengthen those partnerships.
From Global, Brittany.
Good morning, Mr. Premier. Brittany from Global News. I'm just wondering, with all of the discussions that you had with organizations, businesses, and people in the community, what specifically changed in this new finalized plan?
Well, many things, Brittany. I'd say dozens of things, actually. Some of them may be tweaks that you might say are pretty minor, but some significant ones. From the original draft, just as an example, on the post-secondary educational, organizational, and vocational college front, limited openings there, which weren't part of the original draft plan. The reopening also of arts and cultural activities such as dance classes wasn't in the original plan, but is now. Detailed guidance for seniors clubs, limited ability to open seniors clubs with limited capacity, up to 15 people max. Those are new measures, and there are many others. Also on the protocol side, lots of enhanced input that we have acted on in the protocol aspects, which Manitobans can have a look at. Go on COVID-19. You'll be guided into there, and then you can have a look at the protocols. I know a lot of small businesses are very appreciative of having the chance to have input through that. I know the Chambers, Business Council, the Canadian Federation of Independent Business, many other groups, manufacturers and exporters, Retail Council, all had input into our plan. So it's truly a plan designed by and for Manitobans, and very much appreciate all the input. So there was lots of clarification around community centers, some guidance there on how to operate effectively, removing occupancy limits for therapeutic and healthcare services, some detailed public health guidelines we added for film productions. Just some very exciting changes. I'm very pleased with the work that went into the plan, and I'm very thankful for the input that we got in the improvements of the plan.
Thank you. And just a bit of a shift in here. I know that we already have asked people or made people who are coming into Manitoba that have traveled from elsewhere having to quarantine or self-isolate for 14 days. But are you looking at possible restricted travel to places like Quebec and Ontario to protect Manitobans from bringing COVID back here from some of the provinces that have been the hardest hit?
Yeah, it's a real good question, Brittany. You're seeing, all Manitobans are seeing the numbers in Ontario and Quebec, and it is sad. And in particular, of course, you've seen the report on the seniors' homes yesterday. That was just awful. And this raises concerns, obviously, about interprovincial travel. This is why the premiers, and we'll be talking again tomorrow on this issue and others, but this is why the premiers are dialoguing constantly on this issue. None of us wants to create a country where there are barriers between each of us on the one hand, and on the other hand, we'll have to be sure when people move, as we will want to do as the economy reopens, that we're all safe. This is why I'm advocating, and other premiers are too, for improved tracking on our testing. This is a very important part of how we ensure that we are able to be safe as the economy reopens and as people begin to do the things that they did in the past in terms of travel, whether for business or to see family or for other reasons. They will need to be kept safe. We will need to be kept safe when that movement occurs. And this is where a big part of the tracking comes in, so that we're able to make sure that we're limiting the spread of COVID that may occur as a consequence of gradually removing these restrictions that we know we can't have in place forever. And so it's that gradual progress that we're after. And this is, you raise a good point about the importance of maintaining the safety while we're doing that.
From the Brandon Sun, Colin.
Hi, Mr. Premier. Colin Clark with the Brandon Sun here. With Phase 2 happening on Monday, I was wondering if any more progress has been made on the paid sick leave plan you were touting with the premiers of BC and Yukon yesterday.
Yes, I think some progress has been made, and I would say thank you to the representatives of various labor groups, whether public sector or private, whether unionized or non-unionized. We've had, I think, 3 good discussions, sharing perspectives on this. I think we all recognize that there are some challenges. We want to make sure that we're coming up with a plan that's broadly, though never universally accepted by all groups. There are too many groups. We're going to have some disagreements, but I think we've done a good job. Our officials have done a good job of getting honest viewpoints from various representative groups. And I'm hoping to have something to announce in the not too distant future in respect of a bit of compensation for our frontline people around the country, around the province of Manitoba.
No follow-up question. Thank you.
From CJOB, Diana.
Good morning, Mr. Premier. Diana from 680 CJOB. Was there any feedback on the Phase 2 plan that surprised you?
Well, let's be frank. You know my affection for seniors and my concern about how this impacts on seniors especially. And this is a tough issue because when you look at the stats, you know who the greatest risk, who's assuming the greatest risk on COVID, and it is our seniors. And so being able to have a limited opening of a seniors club, which is where my grandfather and my mom spent so much time in their retirement, is fraught with a sort of a double edge. I'm pleased because I know how important these senior centers are for giving seniors an opportunity to interact with one another, to get out of their residence and to share experiences and memories and joy with one another. I know how important they are, but I'm also very, very conscious that we be careful. And so the guidelines around these reopenings are very clear, and we would expect them to be followed, and I know that seniors will understand that. But I think they'll welcome the opening. But you asked me, surprise wouldn't be the right word, just joy and concern at the same time as we start to gradually, carefully reopen our seniors' facilities. I think that would be one of the areas we're going to watch carefully, and we're very hopeful that it will work very well with the right distancing, with the right practices and the right discipline. We hope that can work.
Thank you. And then just as a follow-up, what is the province considering as far as tracking goes? I know Alberta has an app. You said before that a Made in Manitoba solution is ideal for us. What have you been told as far as where we are on using technology to track the spread of COVID-19 here in Manitoba?
Yeah, we're on that, and it's experimental in some form, but it's in practice in some places. So we're looking at technology. There are some hiccups we want to work out before we can introduce it. But we do think this could be part of a national tracking program, and that's part of our goal, as I mentioned previously, to be sure that we're able to track not just within Manitoba, because clearly Manitobans love to move around, and they've been restricted in that ability. As we move forward, they'll be able to do more travel, but they'll have to be commensurate, we hope, with some additional strengthened tracking systems. So that's where the federal partnership will be very important, and the coordination among obviously all our provinces will be vital.
From the Winnipeg Sun, Josh.
Good morning, Premier. This is Josh Aldridge with Winnipeg Sun. Just to follow up on that question, as we look at some of these tracking options that are out there, how do we balance civil liberties and privacy when we're developing this technology? How do we balance that against safety and healthcare and well-being for the population?
Yeah, Josh, I mean, you just defined the exact challenge we face in every respect within this pandemic, and facing up to this pandemic challenge has been a trade-off. It's a bit of a balancing act, isn't it? So, there have been some restrictions on fundamental freedoms throughout since the time we had to announce essential services rules. I'm a freedom lover. I know how hard people fought in our history to give us these freedoms, and they're precious. And we also know the balancing act that without any restrictions, COVID would have been here. We'd have lost friends and family members as a consequence. It's a balancing act. And so as we move forward, we have to make sure that we are conscious of that balance and that we are striking the right balance. That's what we've endeavored to do as a government. I think it's what Manitobans are sensitive to. They know that they're restricting themselves. They know that through the discipline they're demonstrating that they're losing some benefits. I mean, hugs are not as prevalent. Handshakes are gone. The fact of the matter is our interpersonal opportunities are limited and lessened. But in that limitation, we're saving lives. And so it's the gradual reopening and the gradual return to some of our things we took for granted perhaps in the past that I think we're all after, but we want to do it safely and carefully.
My second question is, you touched on the report regarding seniors facilities in Ontario earlier. Is the province going to take a closer look at what's actually going on in senior facilities here, whether it's infrastructure and things that need to be repaired and just the services that are being provided before those restrictions and health orders regarding seniors' homes and long-term care facilities can be reopened here? Not saying exactly what's happening in Ontario is happening here, but is the province going to be doubling down on those efforts just to make sure those things are not happening here before those orders are lifted?
Well, I think we should commend Cameron Friesen and his team at the Health Department for all the work they've done in partnering with our seniors' facilities, because our results are remarkably different from those of other jurisdictions, in particular Ontario and Quebec. So I think there's a little bit of credit that should go out to them. We have done a number of things to strengthen our practices and policies around seniors' homes to protect our precious seniors, and I think that that's critical as we move forward. But certainly we'll examine in detail the report from Ontario and see what we can glean from it and learn from it. And there are other measures that are in the planning stages right now that we believe can help to improve the quality of life and the security for seniors, not only in our personal care homes, but for seniors generally who wish to remain in their own homes as much as they would prefer not to need to go to a personal care home. They may at some point need to, but they want to be able to stay in their own homes too, and those securities are important for them in their own homes as well.
From CBC Radio Canada, Laïsa.
Bonjour, Monsieur Pallister. My first question will be the pandemic has seriously affected many sectors, and I want to including like tourism. Does Manitoba intend to implement a strategy to encourage local tourism and encourage Manitoba to visit the province to relate this industry?
I think that I got the gist of the question there, Lisa. I think that the promotion of tourism within Manitoba right now by our Travel Manitoba people, as announced yesterday, is logical, makes eminent good sense. I think it makes good sense anytime. I think we have a beautiful province within a tremendous number of attractions, and subject to the discipline that we've demonstrated thus far in terms of maintaining social distancing practices and making sure that we're not going out when we're sick and others. I think it's great advice they're giving, given the restrictions on travel internationally and domestically in terms of the 2-week isolation periods necessary when you move from one jurisdiction to another. This is a logical thing to promote. And I think also our small business community across the province will appreciate generally the focus on safe travel within Manitoba for tourism purposes. But again, we'll move gradually and carefully on these measures as we always have.
And my second question will be the reopening of the economy. Some experts are saying that things are going too fast, and the fact that we are reopening, we may have like a second phase of the pandemic, and they're even making the comparison with the Spanish flu. Is the Manitoba ready now to face a second phase of the pandemic if we're having like a lot of cases in Manitoba?
Well, you know that old adage about prepare for the worst and hope for the best. We are prepared for the worst. Our capacity has been strengthened in every aspect of pandemic planning. We're confident of that. we have the ability to respond should there be a resurge. We just don't want one. And so this is why I continue to emphasize slow and careful movement in the direction of easing our restrictions is the right approach. Some would argue that we're not moving fast enough. Some would argue that it would be better to just let people be free to do the things they did before. And I get that. I get that there's increasing stress and pressure on many families and on many individuals, on many small businesses. I totally get it. But I also know that if a COVID comeback occurred, we'd all regret that. We'd regret it in the loss of life and in the hurt it would cause others, and we regret it in the dangers it would create for our economic recovery too. So we're trying to strike the right balance, and we think it's a thoughtful balance, balancing security with recovery, and making sure that we're doing our very best to stick to the fundamentals that have got us the progress to date that causes us to be able to say proudly that Manitoba is among the true leaders around the world in fighting COVID effectively.
From CBC Manitoba, Bart.
Mr. Premier, let's say in a couple of weeks or months we get a spike in hospitalizations or ICU admissions due to COVID-19. Which services do you reclose first, and how much notice would be provided there?
It's a great question, Bartley, and as you know, it's an important question too. It's why we've considered in such detail the plan as we've unveiled it both in phase 1 and now in phase 2, and why we're moving gradually so that we can continuously monitor. I would suggest also to Manitobans, it's important not to just look at case numbers. I know that over the last number of months, we've all watched the news coverage or read of case numbers. Case numbers are not the best indication, according to our medical advice, and Dr. Roussin can give you more detail on this, on our progress. What is a real good indicator, not the only one, but a real good one, is the percentage of positive tests that come out. Right now in Manitoba, we're basically 0.08% on positive tests, which is really, really low. It's not zero, but it's low. We'll watch those positive test numbers. If they grow by 10%, 20%, or 30%, it's still not a concern. So I'm coaching right now a little bit, Bartley, and just saying to Manitobans, don't panic if we start to get some positive tests, because we're doing more tests. And as we do more tests, there's a likelihood there'll be more positives. It's the percentage of positives that matters more. And so don't panic if we start to get some more tests. Also, positive tests. Also remember that as we travel more, I know that you're a lover of the outdoors. As more people around the province interact and engage in outdoor activities, there's a possibility that there'd be some community transmission. Again, there's a danger in not proceeding the way we're proceeding too, in that everyone is then isolated, forced to be non-active, forced to experience to a greater degree some of the mental health stresses that go with that isolation. Pressures on both sides. We're trying to strike the right balance, I guess is what I'm trying to say. And I think in moving forward, we'll continuously monitor the situation and take what we hope will be the right decisions, not just for the short term, but for the long-term progress we all want to see.
Okay, thank you for that. Topic change, Bill. How will the province dole out the $25.6 million to post-secondary institutions as part of the transition fund?
Sorry, Bartley, you clicked out on me halfway in there. Can you just repeat that for me?
Yes, of course. My apologies. How will the province dole out the $26 million in its post-secondary institution fund? Like, which universities and colleges will get it, under what conditions?
Yeah. No, thanks for raising that. Had good discussions. My Minister Eichler had a really helpful, I think, discussions. I would hope the post-secondary leaders would agree this week to clarify some of the aspects of going forward strategy here. And there's more dialogue that is planned in the not too distant future. I think next week another meeting, and I expect many more, because the post-secondary training aspects of our recovery are really critical right now, and we're in a dynamic time. So I referenced earlier a number of other jurisdictions have have established, I think, better mechanisms for interface than we've had in the past in terms of not just dialogue, but actual strategies, strategic approaches to design post-secondary instruction in a more coordinated and effective way. So we're looking to do that. Allocation decisions, the minister will have more detail to share, I think, with post-secondaries before we go out to the general public on that. But he has shared a decision that we've made to revert away from the planned budgetary 1% reduction to ensure that at the very least stable funding based on the previous year's allocation is going to be there for post-secondary in the coming, in this fiscal year.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, there's a phase 3 in the not-too-distant future. We were told no sooner than June 21st that movie theaters, casinos, amusement parks, and some of the things that still have to remain closed might reopen. Cameron Friesen talked on the town hall last night about religious services happening sometime maybe before phase 3. Can you tell us, has any of that timetable been adjusted or moved up because of the continuing low COVID-19 numbers?
Well, I'm going to give you a dichotomous answer, if that's the right word, Steve, and just say this. Yes and no. There's ongoing dialogue, and as we move forward, we'll move forward carefully. But I would not want anyone to presuppose there's a step 3 when we haven't even gotten into step 2 yet. One step at a time, and I want to maintain the discipline that has got us the progress that we've experienced to date. And I would emphasize to Manitobans, the only reason that we've been able to make the progress we have is because of you. Because you listened and you acted and you did the right things. Keep doing those things, and then we'll talk about stage 3.
And as a follow-up, I want to ask you about the paid sick leave program that the provinces in Ottawa are talking about. Do you have a funding formula in mind for that? Is there a certain percentage or dollar amount you want Ottawa to pay for this?
No, I think we're at this stage, Steve, just encouraging that debate, that discussion to happen. I've had discussions with now with 4 premiers in the last 24 hours on this issue. I would encourage that discussion to take place. I don't want to get into presupposing certain models because I think at this stage we really would just like to encourage a national program. And so we'll need to have the inclusion of all the premiers. I'll have a call tomorrow with the premiers in an effort to promote the concept because I do think it makes good sense. There are a lot of Manitobans who go check to check, who don't have the financial security that they would like to have and who might be under some financial pressure to return to work when they're ill. I wouldn't want to see that happen. I don't think anybody wants to see that happen. And there are some supports for many people. For example, in the public sector, we have some good supports built in, but in many parts of our economy, there are people who work part-time or casual or who work in low-benefit environments, we'll put it that way, who should be encouraged to get tested when they have symptoms and encouraged to stay away from work until it's determined that they're healthy and safe. That's in everybody's best interests, and I'd like to see us arrive at some type of program nationally that would cover everybody in that event. Our small businesses can't afford to pay for these kinds of programs. This is a program governments should fund federally, in partnership potentially with the provinces to some degree, a program that would at least give support for a minimal period of time while people have to take time off work so that they are not encouraged to go to work when they're unwell. And no one would benefit from that. Everyone would suffer as a consequence of a COVID comeback, and we want to avoid that. So an interim program, I'm not trying to suggest we should change the entire fabric of all our social programs in response to this pandemic. I think that would be an over-response, Steve. But I do think that it's very important that we do what we can together to avoid a COVID comeback in this country. And the way to do that is to make sure that we encourage people who have symptoms to get tested and to stay away from work until they know it's safe to come home or come back to work.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier, Jeff from CTV Winnipeg. In Phase 2, you're lifting some occupancy limits. Why do you feel it's safe to do so for those businesses as of Monday?
Because I'm basing our plan and its recommendations on an extensive consultation with Manitobans, but also with great advice from medical experts, Jeff. And the advice we've received is that this is a time to do this and that it is a safe time to do it. It's a careful move in the right direction.
Thank you. And finally, on another topic, the 5 days of unpaid leave proposal for civil servants. Have you come to any agreement? Is the province moving ahead on that plan?
Yes and no on the agreement, but very close, I believe. And yes, we'll move ahead with that plan. We think it's the right thing to do. We've got 50% of our private sector that's either lost their jobs or has taken a big cut in pay, and we're asking for 2% from the public sector. We don't think that's too much to ask. We're all in the same family, and we can't have us ignore each other in the family. We're going to consider each other. The reality of the situation is that there is less of a need for public sector work right now, and a 2% reduction isn't too much to ask. So we're going to do this together. We're going to do it fairly, and we're going to do it with minimal layoffs. This government has always tried to avoid laying people off work. We want to see partnerships that develop that keep people at work as much as possible. And we think this is a fair and right thing to do. In partnership with our labor organizations, I believe we can make progress on this over the next not too distant future. Just want to say thanks to everybody. Thank you for this day. This is a good day for Manitoba and for Manitobans. It's a careful, balanced approach we're taking, but it's one that is absolutely essential to get us back to the kind of quality of life we deserve to enjoy here in this beautiful province. So stay disciplined, keep following the advice of Dr. Rusin and others, and we will together beat this thing. Thank you.